Have you ever heard the claim that we only use a small portion of our brain? Some people have gone as far as saying that we only use 10% of our brain at any given moment. And they've implied that if we would use 100% of our brain, then our capacities would be tremendous. How can we find out if this claim is true? In this module, we will talk about thinking critically about biopsychological claims. Thinking critically is such an invaluable skill. It is something that comes in handy in every aspect of our lives. Biopsychology is not the exception. Critical thinking is nothing more than the ability to evaluate scientific claims by identifying potential omissions or weaknesses in the evidence. Although it is safe to assume that a published article, specifically in a reputable scientific journal, would be free of unrecognized flaws, unfortunately that is not the case. Although the review process to publish in a reputable scientific journal is good, it is not a guarantee that there are no flaws in there. In order for us to assess everything, we must engage in critical thinking for every single one of the claims made. In 1965, Dr. José Delgado claimed to have found the taming center in the brain. He claimed this by observing and demonstrating to the popular press how a charging bull could be tamed using a stimulation of its caudate nucleus. This was done so by implanting an electrical device in this specific part of the bull's brain. Although the press did see the bull turn away and no longer charging the individual, not everyone was convinced that this had in fact been the discovery of the taming center in the brain. Think of any possible alternative explanations, and while you do so, please make sure to use at all times what is known as Morgan's canon, which is to give precedence to the simplest interpretation for a behavioral observation. To understand this case further, it's important for you to know that when the bull charged, Dr. Delgado delivered an electrical stimulation to the caudate nucleus of the bull via the implanted electrode. This stopped the bull's charge, and after a few attempts, the bull stood tamely. These findings were praised by the popular press and by Dr. Delgado himself. They were quoted by saying that this had been a major discovery, the discovery of the caudate taming center. In fact, it was even suggested that the caudate stimulation might cure human psychopaths. Making use of Morgan's canon in no case is an animal activity to be interpreted in terms of higher psychological processes if it can be fairly interpreted in terms of processes which stand lower in the scale of psychological evolution and development. In other words, as we look at the bull's behavior, it is important to note that in various ways the brain stimulation could have aborted the bull's charge, but not because we had tamed the bull. A simpler response or a simpler explanation could be explained by stating that the stimulation may have simply rendered the bull confused, dizzy, nauseous, sleepy, or temporarily blind rather than having controlled its aggression. The stimulation could have also been painful, which could have deterred the bull from charging. Thankfully, this claim of the discovery of the taming center was not applied to humans. However, there were other studies that were not stopped and made their way over to the human race. Prefrontal lobotomy is one of those cases that impacted the human race in a negative fashion. In 1949, Dr. Egas Moniz, received a Nobel Prize in Physiology and Medicine for developing this technique. Dr. Moniz based his technique on a report that a chimpanzee was easier to handle after a part of her prefrontal lobes had been destroyed as part of an experiment. Following the initial reports by Dr. Moniz of the operation's benefits, it was performed on mentally ill patients all over the world. Lack of critical thinking led to Dr. Moniz receiving a Nobel Prize in Physiology and Medicine for having invented this technique. In his acceptance speech, he said, quote, "Normal psychic life depends upon the good functioning of brain synapses, and mental disorders appear as a result of synaptic derangements. Synaptic adjustment will then modify the corresponding ideas and force them into different channels. Using this approach, we obtain cures and improvements, but no failures." This technique was such a hit that various forms of the operation were devised. One of them was the transorbital lobotomy procedure, which was performed by inserting an ice pick-like device through the eye sockets, often in the doctor's office. While Dr. Moniz and his colleagues claimed that this would lead to cures and improvements and no failures, they failed to evaluate human patients and the consequences of the surgery. The first reports that the operation was therapeutically successful were based on the impressions of the individuals who were the least objective, the physicians who had prescribed the surgery and their colleagues. Patients were frequently judged as improved if they were more manageable. Little effort was made to evaluate more important aspects of their psychological adjustment or to document any adverse side effects. Some of those unforeseen side effects were immorality, lack of foresight, emotional unresponsive, epilepsy, urinary incontinence, among many others. What this unfortunate treatment has led us to is to determine and establish that no program of psychosurgery should ever be initiated without a thorough assessment of the effects of the surgery on a larger sample of subjects from various non-human mammalian species. Here you can see the gruesome details of how the prefrontal lobotomy was performed. The first figure here, you're able to see the part of the brain that was targeted by Dr. Moniz and his colleagues. They would insert a leucotome, which is this device here, that after each insertion, the cutting wire was extruded and the leucotome would be rotated so it could cut out a quart of the tissue, specifically the prefrontal tissue. As it gained popularity, we also began to see the transorbital procedure, which you can see in this slide here. And this is where the individual would no longer receive any type of cuts through the cranium, but it would be done so through the eye. I hope you're able to appreciate the importance of thinking critically about every claim made.